everyone, I'm Joni Rutter. I am the Acting Director for the National Center for Advancing Translational Sciences. Today, we celebrate the incredible accomplishments of the NIH community over the past year. The NIH Directors Awards recognize superior performance or special efforts significantly beyond regular duty requirements and that advance the mission of the NIH. And I am thrilled and proud that the following NCATS teams are being recognized for the NIH Directors Awards this year. Our first two awards are in the scientific and medical category. The first is for the National COVID Cohort Collaborative, or N3C. And in the beginning of April 2020, NCATS spearheaded the creation and establishment of the N3C Data Enclave. It's a secure platform technology to house COVID-19 patient electronic health records, or EHRs, and make the data quickly accessible for the COVID-19 related research. This effort was stood up in just 5 months' time and required deep and wide collaborations to rapidly develop and activate this national resource and make the data available to the entire research community in a time of great urgency. Prior to the pandemic, NCATS's Clinical and Translational Science Awards, or CTSA program, had been working to address the lack of interoperability of patient EHRs. It's a bottleneck long recognized by the clinical informatics community. The CTSA program and the NIGMS's Clinical and Translational Research program developed an approach to harmonize common data models. The rapid spread of COVID-19, though very difficult to watch, provided the use case for testing the utility of EHR harmonization and its access for research. NCATS provided stewardship of N3C and established a secure cloud-based space for collaborative analytics and exploration of using this real-world data. The secret to N3C success is more than access to information. It's the people that make it happen. And N3C certainly takes a village. So buckle up, there are a few groups that I want to recognize for this award. NCATS N3C leadership team addressed the operations, governance, and oversight, and collaborations and discussions from many NIH institutions and offices were involved, as well as with the broader informatics community. The NCATS Office of Grants Management and Scientific Review shepherded the review and oversight of proposals to support N3C extramural activities. The NCATS Information Technology Resources Branch established the cloud-based home for the enclave, the oversight, assessments, and penetration testing to protect the privacy of patient data and maintain a secure cloud environment for its users. The NCATS Office of the Director, Office of Strategic Alliances, Office of Policy, Communications, and Education, and the Chief Medical Officer worked closely with the NIH OD counterparts in the Office of Science Policy, Office of General Counsel, the Office of Management Assessment, and the NIH Institutional Review Board to develop the formal agreements and to align those with community user policies, as well as NIH policies and regulations. And they also sponsored the NCATS N3C protocol for approval under the NIH IRB. The N3C Data Access Committee, or DAC, and its team supported the responsible and reviewing and approval requests to access N3C to ensure that the approved projects were COVID specific and that users were compliant with all of the requirements, the data access levels were appropriate, and so on. And they also assured this that users would get access in record time. And in partnership with the Office of Data Science and Strategy, there were robust efforts to enable access to and use of powerful tools for data management and analytics that are just beginning to be realized. As of today, the Enclave has electronic health record derived data representing nearly 9 million people, of which nearly 3 million are from COVID positive patients. Currently, there are 66 sites across the country that contribute to data to this effort. And it's already producing results, including knowledge about long COVID, information on treatment effectiveness, and patterns that highlight communities of greater risk of hospitalization and mortality. So congratulations to the NCATS N3C team in recognition of the exceptional vision and implementation of N3C. The second scientific and medical award is for the NCATS Open Data Portal. Since the start of COVID-19 pandemic, there have been scientists around the world who have mobilized to understand the disease and to develop therapeutic interventions to mitigate its impact. Numerous drug repurposing and mechanistic screens have been undertaken against the virus. And though the results of these studies are often shared incompletely or slowly, our hope was to mitigate that. So the group nominated here worked together to design and implement an open science data sharing hub for NCATS's SARS-CoV-2 research efforts. NCATS scientists rapidly and openly shared their SARS-CoV-2 screening data on this resource and quickly build a foundation of knowledge to further guide other research efforts. And within a matter of weeks, this group outlined a new way for NCATS to launch this resource as the NCATS COVID-19 Open Data Portal. Their contributions helped push the boundaries of open science adoption at NCATS and have built a foundation for a transformative new platform of data sharing and drug repurposing that will help accelerate discovery beyond COVID-19. So congratulations to the Open Data Portal design and launch team. The next 3 awards are in the administrative achievement category. The first one in this category is for the NIH Virtual SARS-CoV-2 Antiviral Summit. This summit was held on November 6th, 2020, and the virtual summit was organized to provide an overview on the status and remaining challenges in developing combination antiviral treatments for COVID-19. The goal of the summit was to review the current state of the science, identify unmet research needs, share insights and lessons learned from treating other infectious diseases, as well as to identify opportunities for public-private partnerships and assist the research community in designing and developing antiviral therapeutics. The summit was organized by a small, focused team within about 6 weeks and required a true above and beyond effort to plan and execute. This team met daily to coordinate with NIHOD, NIAID, and NCATS, and the summit involved presenters from pharma, academia, and the government. The team has subsequently produced a summit report, which was published in the Journal of Infectious Diseases. So congratulations to the Antiviral Summit team for the organization of this antiviral virtual SARS-CoV-2 antiviral therapeutics summit. The second award in the administrative category is for the RADx-RAD Objective Review Team. In order to ensure efficient solicitation, review, and issuance of emergency awards in full compliance with NIH policies and procedures, NCATS staff members designed, developed, and implemented a comprehensive policy and operations package for the RADx-RAD initiatives. The peer review grants management teams adopted their efforts to meet the need for rapidity in a manner that did not result in additional risk to the NIH. The comprehensive package for the conduct of the objective review included a conflict of interest policy, evaluation templates, privately shared work sites that allowed access by individuals outside of the NIH firewall, and a process for securely transferring post-review documentation into the grant files. In addition, NCATS staff managed pre-review activities and conducted meetings for the objective review of the corresponding NCATS RADx-RAD FOAs. Finding operational efficiencies, that's quintessentially NCATSian. So congratulations to the NCATS RADx-RAD Initiative Objective Review Team for designing, developing, and conducting an efficient review for these emergency awards. The third administrative category and the last award for this NCATS section is for the SARS-CoV-2 BSL-3 Lab Stand-Up Team. Testing of therapeutic candidates against live SARS-CoV-2 virus requires working in a biosafety level 3 laboratory, or BSL-3. At the start of the pandemic, there was no BSL-3 drug screening capability anywhere at the NIH. So the group nominated here worked together to find solutions to the need for BSL-3 testing for drug repurposing at NCATS. NCATS scientists initially identified other laboratories capable of performing screening in BSL-3 labs and arranged for plates within our drug repurposing libraries to be prepared and shipped. And this also required rapid purchasing turnaround. Purchasing agents had to work basically day and night to get this turned around to ensure the contract labs could perform testing as rapidly as possible. NCATS established a BSL-3 testing pipeline so quickly that they were able to test candidates for NIAID extramural groups as well. And in addition, NCATS scientists worked with NIAID to negotiate access to laboratory space in NIH Building 33, the dedicated BSL-3 research building on the NIH campus. And they worked together to design a lab and procure assays, cell lines, screening libraries, and enable testing using SARS-CoV-2 virus. And this will allow NCATS to continue to respond to the pandemic and NIH to ensure that it's prepared for the future pandemics. So congratulations to the SARS-CoV-2 BSL-3 Lab Stand-Up Team for identifying solutions and the need for BSL-3 laboratories to test these therapeutics in SARS-CoV-2 viruses. Thank you for joining me as we celebrate all of the awards for their awardees for their truly important work over the last year. The circumstances haven't always been ideal, but the staff, NCATS staff, and our colleagues continue to rise to the occasion. So congratulations to these NCATS teams and all of the NIH Directors Awards. Thank you.